all focus on our health, it's important not to forget breast care, and that's for women and men. I spoke with Southwest Medical breast surgeons to learn more, and here's our conversation. So let's talk about some of the frequently discussed topics regarding breast care. Starting here with, if you have a high risk for breast cancer, a high-risk program offers many options for testing, cancer screening, and risk reduction options. So let's talk about those options.
Part of options are, one, getting women to establish and how best to actually obtain their screening films, when to obtain their films, should there be additional studies. And really, every individual is kind of different. So what happens to be a high risk and what makes you high risk is going to be different to the person sitting next to you in that waiting room, and how best to kind of manage that. Sometimes that's going to be more frequent clinical breast examinations, maybe more clinical studies. To a degree, could it be medical management with different type of what we call endocrine management, to even surgical management based on their high risk status. It's kind of, in some sense, it's multidisciplinary for each patient, and not everyone's one standard cookbook.
Dr. Connors, how do you respond to high risk breast cancer patients?
When we talk about assessing somebody's breast cancer risk, we take into account family history, personal history, what your mammograms are like. Have you had previous biopsies which may or may not have shown something abnormal or just something that you have to keep on top of, versus actual breast cancer. And then we say, all right, you have breast cancer now. Do you have one of the kinds at higher risk for coming back? What do we do to decrease your risk going forward?
And I see here some of those lifestyle related risk factors you have the power to control yourself.
Yes.
So can we talk about that list?
And once you get through menopause, it's very important that you try and maintain a healthy weight. Studies show that if you gain weight after going through menopause, it increases your risk for breast cancer. And literally it's because fat tissue makes hormones. So it's like taking hormone pills. If you do have menopause symptoms, the hot flashes, the headaches, all the things that drive people crazy, use the minimum amount of hormone pills that you and your OBGYN or your primary care agree on to alleviate the symptoms, to kind of get you through that. Making sure you're exercising to some degree. It doesn't have to be a heavy duty workout with weights and everything. Just get up and get moving. Keeping your alcohol intake under control.
And really, it's about also screening, keeping patients on track. I mean, outside of even our high-risk patients or patients who have previous history, it's about keeping patients to remember at 40, we really do recommend a screening mammogram. We do recommend still self-breast examinations and being cognizant of their own breast care kind of as they go through. Don't leave it up to anybody else to make sure you're getting your yearly mammograms. You have to make sure you're keeping yourself on track.
Okay, I want to thank Southwest Medical for being one of our Community Pride partners. Las Vegas Now will be right back.